When were you diagnosed with multiple sclerosis?
I was diagnosed in about the summer of 1998.
Do you remember what it was like living day to day with MS? How did it affect your life?
Well, the problem in my case is it had gotten worse all the time. It's progressive, and therefore it's constantly a problem of readjusting to more and more disability. So,
how did it affect you? Did it affect your reading and writing and speech?
oh yeah, I have visual problems. I have optic neuritis. I can't read very well, and it's affected my legs quite a lot. I have trouble walking very far, and my balance.
Now, I know your transplant was just about a month ago. Is that correct?
Yeah, the day of the transplant was about 27 days ago.
So you probably haven't seen any improvements yet, but what I'd like to know is, where do you see yourself in a year from now?
Well, that's a good question. You know, some people that I've actually met have shown a lot of improvement. And obviously I would hope to show improvement. I would hope to get a lot better. I'm not counting on that. I'm sort of planning on getting this stabilized and at least not being any worse. But if I could get better, that would be great.
Since the transplant is fresh in your mind, what can you talk about in terms of challenges and the things that may have been most difficult throughout the process?
Well, it was hard being in the hospital for 3.5 weeks. I think the hardest part was trying to eat, really. That was very difficult. I lost about 20 pounds, which was okay for me, but it was very difficult to eat. That was like the hardest part of the whole thing. A lot of nausea, a lot of trouble eating. Other than that, it wasn't too bad.
Any advice for those that will be going through transplant in the future?
Well, my advice would be to try to get it done as early as possible, because that way, you know, you can get it stopped before it gets too bad.
And how did you find out about the program?
My family doctor told me about it. He's an internist in Florence, Oregon. I don't know how he knew about it. He just told me about the subject in general of stem cell transplants for MS. And then I started looking on the internet and calling around the different places in the country, and it kind of got narrowed down to Northwestern, and Dr. Burt was the place to go. So I called out here and got it lined up.
In terms of going through the transplant, did you make the right decision?
Oh, without question, it's the right decision to go through the transplant. It's certainly given me a lot of hope. Hopefully it will all work out okay. I won't know for quite a while yet, but it was certainly worth doing.
When were you diagnosed with MS?
The official diagnosis for MS was April of '97. In actuality, I had symptomatology for a year previous. The provisional diagnosis is ADEM, which is fancy abbreviations for acute disseminated encephalomyelitis, which I did not meet at all, but they had to have something. And it was a year later that they did serial MRIs and decided that it was indeed MS versus ADEM. I really didn't have any acute changes. It was rather gradual onset from presentation.
Can you describe what it was like living with MS before your stem cell transplant?
Prior to the transplant, I had the initial presentation was sudden with a grand mal seizure, and then it totally affected my lifestyle and my profession. Within a year, I had lost my career, my license, my profession. I had physically had progressive symptoms that continued up until the time of the transplant. The treatment modalities I was refractory to, so it continued to get worse. That was quite dramatic to me, at least.
And how long ago was your stem cell transplant?
I had it 11 September 2000.
In your own words, can you describe what the transplant was like for you? The challenges?
I think to get it going and started, is this the right thing? Is this the wrong thing? What am I doing? I guess I'll do it. Those kinds of questions go through your mind, but actually the process of getting it going went relatively smoothly. I was very impressed with NMH. I have them as excellent in my book. Working as a critical care nurse my whole life, I felt like I had a very appropriate way of assessing them. They watched me, took care of me. They treated me as a whole person. In terms of the actual procedure, you know, you expect when you have chemo and radiation that you're going to get sick and have problems. And indeed, I did have some problems with nausea and vomiting. I had some discomfort with one of the medications that they give you that causes some mild bone discomfort. And actually, I had more than what was typical. The absolutely fascinating thing was Dr. Burt came in. And when he saw I was uncomfortable, he frowned and looked like he was hurting, and he immediately got me some analgesics that quickly took care of the discomfort. The nausea was amazingly well controlled. They had like 3 different medications. So even though I threw up a few times, a couple times a day for a few days during the worst of it, you know, it's kind of like I have actually had bad cases of the flu, which were worse than going through the worst portion of the transplant, which was about 2 weeks. So yeah, it's really hard. You don't want to have 2 weeks of the flu and all the sundry symptoms that go with that, but it actually was okay. I was surprised.
In terms of the MS, how has the transplant changed your life?
Well, I am day 508 now, so it's been 508 days, and over that time, I have progressively gotten stronger. I can't say that I'm totally back to my strength from before the transplant, but I feel like I'm still getting stronger. I am now up to about an hour before I need to sit down and rest. I still have fatigue problems, but that has even improved since last September when I had my 1-year evaluation. So things have gotten better from that period of time.
Your quality of life has improved?
Well, yeah. Prior to the transplant, my main presentation was not totally typical of MS because the main symptom was my cognition. The remarkable thing is they don't tell you that you're going to improve. You shouldn't expect that you're going to improve. It's designed to stop the progression. And with my situation, I did have improvements. The most notable one that I always hear comments from everybody is that I no longer stutter. I've always been very articulate in my profession, and I got to the place where I would talk like that, and I couldn't get my words out. And within maybe a few months after the transplant, I literally have stopped stuttering. The only time I have trouble with some of my symptoms now is when I'm fatigued and tired. But the positive comments has been great. My walking is better. I no longer fall. I trip a little bit. Some of the other things like the bladder problems are well controlled and they're not getting worse. And that's, oh man, it's great not to, okay, what's going to happen next? Am I going to get worse? I actually feel stable. And that gives you control of your life back. I have not cried in the last year. I was very depressed when this all started. And amazingly, there's no more depression. It's just nice to have control again.
When were you diagnosed with multiple sclerosis?
I was diagnosed on February 3rd, 99.
Looking back over the last several years, what has it been like living with MS day to day?
It's been interesting, you know, relearning how to do little things like buttering bread and cutting meat and what else.
And you've had to relearn these things after
Yes,
the
and
transplant.
since transplant I gotta relearn again, yeah.
So prior to transplant, what was life like? How did the MS affect your life?
I had problems with, you know, balance problems, tremors in my hands, so writing was not much fun. Fatigue became a big problem, between those, I had to drop out of school because I just couldn't take it. But since the surgery, I've gone back into school, and really excited about that.
Did you have problems with ambulation?
No,
How long ago was your stem cell transplant?
it was a year ago.
And how has your life changed? I know you've said you've had to relearn things, but how has it affected your life?
Like I said, I went back to school, so I'm finishing up school because I can do that now. I'm more mobile. I mean, I can walk around more, which is nice, you know, when I go out and hang with friends. Don't really know what else that's...
I'm sure when you were diagnosed and looking at your life, say 5 years from now, it was a very different picture compared to now and what your hopes and goals are and where you see yourself in 5 years.
Oh, yeah.
Any ideas?
No, actually.
Just living.
I'm just getting used still to this whole everything being different now.
Any advice for those who are just going through the process or thinking about going through transplant? Do you have any advice for them?
I don't know. I honestly don't know.
What was your biggest challenge? Like looking back to the few weeks you stayed in the hospital for the transplant, what do you remember as being the biggest challenge for you? I know you're there a couple
Yeah,
weeks, so
I can't
was
say I really remember.
so it was a long few weeks for you.
The biggest challenge was probably being confined to my room because the immune system was dead and I couldn't catch anything.
Okay, all right, that's it.
I was
Okay.
saying, you had mentioned about the nausea and vomiting. Did you want
You want to expand
to,
on
answer,
that?
you want to put that in there, question?
Did you have problems with nausea? and
That
vomiting?
was another problem, challenge. Nausea and vomiting made it interesting for a while.
Did they have medications to help
They
control?
did. That was nice.
Good.
Yes.
So you had trouble eating.
Yeah. Yeah, there were a few days when Jell-O became about all I ate.
So I would imagine you don't want to see Jell-O for a very long time.
No, actually, it was fine.
Okay, that's it.
Did you feel that went pretty smooth? You want to do that
Want to do it again?
Yeah, let's just do it one more time.
Which
Same-
one?
No, the very last.
Oh, sure.
Yeah, I think we were both mom and dad here when you were doing it.
Okay. So I'm
why
gonna
don't you ask
ask.
that question again?
I'm gonna ask about the challenges. What was your biggest challenge? And you could say,
Okay.
what do you feel like the biggest challenge was for you going through the stem cell transplant?
Biggest challenge, probably, you know, the being confined to my room, not being able to move much, but, you know, it was kind of nice. I had a TV and everything, so it was kind of nice. The nausea and vomiting was not exactly nice itself. Having the PICC line in my arm, having to saran wrap my arm to take showers was interesting, but I kind of liked it. I thought it was kind of cute. Yeah.
The vomiting, nausea and vomiting.
Nausea and vomiting were interesting. They made meals interesting. Like I said, for a few days, about the only thing I could keep down was Jell-O. So, but it still all worked out.
I understand next month will be your year anniversary since the transplant.
Yeah.
Do you feel like you made the right choice in going through the transplant?
Oh yes. Oh yes. Oh yes. Oh yes.